Tonsil stones typically don't pose serious health risks, but they can be annoying to deal with. They can cause bad breath, an unpleasant sensation as if there's something lodged in the back of your throat, or trouble swallowing. So, if you notice tonsil stones on your tonsils, you likely will want to get rid of these pale yellow bumps. Here are some options you can discuss with your doctor, including some common remedies you can try at home. Sometimes home remedies can get rid of tonsil stones, but avoid these missteps. Sometimes no treatment is recommended for tonsil stones. Because they are not harmful, doctors may recommend leaving them alone if you do not experience or are not bothered by the symptoms associated with tonsil stones. If they do bother you, some at-home remedies may help you deal with them. Pushing or squeezing out stones. Many people try to physically remove these stones on their own by pushing or squeezing out these growths with something like a cotton swab, the back of a toothbrush, or even their finger. It can work, but putting pressure on the tonsils can trigger the gag reflex in some people. If you do decide to remove the stones yourself, be sure to push the dislodged stones forward, toward the opening of your mouth and away from your throat. If you do try to remove a stone yourself, do not use a sharp object such as a pen, pencil, toothpick, knife, or safety pin to do so. There is risk for injury to the tonsil and bleeding. There is a risk for vascular injury. Using a water flosser. One of the best methods recommended by doctors for dislodging tonsil stones is doing so with a water flosser. It's a great way to remove them without gagging, and it doesn't involve any sharp implements. It's the safest non-contact method. Yes, sometimes tonsil stones do go away on their own in some cases. Your tonsils can change, becoming more cryptic, meaning they develop more crevices and pits in the late teens and early 20s, and shrinking as we get older. Your doctor may be able to help remove tonsil stones, or decide if surgery is needed. There are no medications you can take to get rid of tonsil stones, and surgical procedures like a tonsillectomy are usually not needed, unless a patient's quality of life is affected by the tonsil stones. But, if none of the previous home remedies work for you, or you have tonsil stones that are too large or too deeply embedded in the tonsils for you to remove them yourself, you may want to consider seeing an otolaryngologist, an ear, nose, and throat doctor. But your doctor can help you decide if more serious treatment is needed. If your tonsil stones are on the severe end of the spectrum, if you're constantly working to remove tonsil stones that persistently grow back, or you're coughing up tonsil stones every couple of days, for instance, you may want to talk to your doctor about surgical options. You should also see your doctor right away if you spot any of these symptoms, which could be signs that you have an infection or another more serious medical problem. Tonsils that are enlarged or look very red, any asymmetry in the tonsils, trouble swallowing, persistent sore throat, bleeding in the tonsils, pus coming from the tonsils, pain and enlarged tonsilliths that interfere with breathing. There are a few surgical options to get rid of tonsil stones, but they're usually only recommended for very severe cases. If your doctor does recommend a medical procedure to get rid of and help prevent future tonsil stones, here are some of the options he or she may discuss. Tonsillectomy. A tonsillectomy is the complete removal of the tonsils. Like any surgical procedure, there are risks of complications such as bleeding and infection. It's also a painful procedure that can involve 2 or more weeks of moderate to severe pain. The tonsils also play an important role in keeping harmful bacteria and viruses out of your body by acting as sentinels and preventing them from entering through your mouth, and should only be removed when absolutely necessary. The bottom line: your doctor may recommend this surgery if the tonsil stones are severely affecting your quality of life, and other methods to keep your tonsil stones in check are not working. Laser tonsil cryptolysis. In this surgery, a surgeon uses a laser to remove the tonsil crypts by resurfacing those areas but not removing the full tonsils. A review published in 2013 in the American Journal of Otolaryngology of 500 cases involving this procedure found that the advantages of this surgery over tonsillectomy included no need for general anesthesia, not having to remove the tonsils, enabling doctors to target only the areas where cryptic pockets are, reduced risk of bleeding, less pain after surgery, and shorter recovery time. Coblation tonsil cryptolysis. For this procedure, doctors use radio frequency energy and salt water to remove the crypts and crevices in the tonsils where tonsil stones have formed. It has all the aforementioned advantages of laser tonsil cryptolysis over tonsillectomy. Additionally, it allows the doctor to operate at a lower temperature than a laser requires, so there are fewer risks than with the laser procedure, such as potential airway fire, retinal damage, and facial burns. Thanks for watching. Make sure to subscribe so you'll first to know when we post a new video.